Hey everyone, let's talk today about stroke and altered mental status, the important concepts, and some practice questions. Just like a heart attack is an interruption of blood flow to the heart, a stroke is an interruption in blood flow to the brain. Another name for a stroke is a cerebral vascular accident, or CVA. Now, normally brain cells send electrical impulses to control specific muscles, the face, speech, arms, legs. If that blood flow is interrupted to part of the brain, then it'll be difficult to control various muscles. There are two kinds of strokes, ischemic strokes and hemorrhagic strokes. Ischemic strokes account for about 80% of all strokes. It's caused by a blood clot or sometimes a spasm that actually stops blood flow to a specific area of the brain. This causes facial droop, slurred speech, arm and leg weakness. Now, once in a while, if the cause is a spasm, once the spasm relaxes, the symptoms will subside, usually within 24 hours. That specific kind of an ischemic stroke is actually called a transient ischemic attack, or a TIA. Hemorrhagic strokes account for about 20% of all strokes. And that's when a blood vessel in the brain bursts, causing bleeding into the brain. It causes facial droop, slurred speech, the arm and the leg weakness. But because there's pressure being put onto the brain from the bleeding, it can also cause severe headaches, nausea, vomiting, double vision, and even sometimes loss of consciousness. When assessing a patient for a stroke, we use the FAST acronym. It's from the Cincinnati Stroke Protocol. The F stands for facial droop. So you ask the patient to smile, and if the patient's having a stroke, then one of the sides, one cheek and lips will go up, and the other one will not. It will actually go down. The A stands for arm weakness. So tell your patient to hold both arms straight out in front of them with their palms up. And if a person is having a stroke, then one side will drift down and they won't be able to keep their arm up the same level as the other arm. The S is for slurred speech. So just talk to your patient, have them say something to you, and you'll notice if they're having difficulty forming their words and speaking clearly. And the T is just to remember that time is of the essence. It's important to get your patient to a stroke center, or if there's no stroke center, at least to an ER, as quickly as possible. The treatment for a stroke, whether it's a bleed or a clot stroke, is the same. Protect the patient, especially their head. Make sure they don't fall if they lose consciousness. You can loosen any restrictive clothing, administer oxygen if needed, protect their airway. You can obtain a blood glucose level. You should place your patient in a semi-reclining, comfortable position. And if they're frightened, make sure that you tell them that you're going to be there to take good care of them. And then transport them, hopefully within 90 minutes, to a stroke center. Because if it's a clot stroke, they can actually inject medications that can dissolve that and actually reverse the stroke. But if it's left overnight, then it will be too late. Syncope, or a syncopal episode, is more commonly known as fainting, and it can be caused by upsetting news, standing in a crowded room for a long time, not eating. The person collapses to the floor. And it's usually self-correcting. Once they reach the floor and they're lying supine, then they regain consciousness and begin to feel better. The treatment for a syncopal episode is to look to make sure that the person didn't hurt themselves when they fell, check a blood glucose, remove them from any warm environment, and offer transportation for evaluation. Another common condition you can come across is a narcotic overdose. Now, narcotics include heroin, fentanyl, morphine, OxyContin. And when a person overdoses on them, they can get a decreased level of consciousness, respiratory depression, cyanosis, and constricted pupils, sometimes called pinpoint pupils. And then on the scene, you may see needles around, or you may even see track marks on the patient. Treatment for a narcotic overdose is first scene safety. You don't want to be kneeling onto a needle. And then assist with the ventilations with a bag valve mask, positive pressure with oxygen. And then administer intranasal Narcan, naloxone, which will usually wake the patient up if the patient is overdosed on a narcotic. It won't wake them up if it's on a different kind of medication or overdose. And then also check a blood glucose. A few terms you need to know. Altered mental status. The term altered mental status just refers to any condition which causes the patient to be less than alert and oriented. The two most common causes of altered mental status are diabetes and drug overdose. Another term you need to know is a memory aid called AEIOU, the vowels, right? TIPS, AEIOU, TIPS. And they stand for the things that are possibly causes of altered mental status, such as alcohol. The E is epilepsy or seizures. The I is insulin, which means diabetes. And then O is either overdose or oxygen, low oxygen, right? Hypoxia. Uremia, kidney disease. Trauma, or high or low temperature, hyperthermia, hypothermia. Infection, which is sepsis, a massive system-wide infection. Poisoning, psychiatric conditions, and then stroke or shock. Let's do a couple of practice questions. So stop the video, read the question, select the best answer choice, and when you're ready, start the video and find out what the answer was. So you're treating a patient who's unresponsive, has a respiratory rate of 3 per minute, and has pinpoint pupils. So that should make you think it's probably a narcotic overdose. You've opened up the airway. What should you do next? Well, blood glucose is something that you could do, but the patient needs some treatment right away. He's not breathing and he's turning cyanotic, so you've got to treat that. Okay. Answer B, oxygen. Well, you can give oxygen by a non-rebreather mask, but his ventilation rate is too slow. At 3, he can't just have a mask put on his face. He won't breathe in enough oxygen. So he actually has to have positive pressure ventilation or a bag valve mask. And C, Narcan is certainly something you're going to give him, but the first thing to do is correct the hypoxia. So you take the bag valve mask, put the bag valve mask on, start ventilating your patient, get your Narcan out of your kit, get the Narcan ready. Then you can pull the mask off of the face, inject the intranasal Narcan, and then continue ventilating. Now remember, sometimes on questions, instead of them saying a bag valve mask, they're just going to say positive pressure ventilation, which is the same thing. So let's try another question. So stop the video, read the question carefully, look at the answer choices, choose the correct answer, and then start the video when you're ready to see the answer. So you have a patient with a history of heart disease and asthma who is unconscious from an unknown cause. Which of the following should you administer? Narcan, oral glucose, nitroglycerin, or an albuterol inhaler? Well, you're not going to administer oral glucose because the patient's unconscious. And you're not going to administer nitroglycerin, 1, because he's unconscious, and 2, because there's no indication for it. Just because he's got a history of heart disease doesn't mean you have to give him nitroglycerin. And an albuterol inhaler, same rationale. Just because he has a history of asthma doesn't mean he needs the albuterol inhaler. Plus, he's unconscious, so you couldn't administer the albuterol inhaler anyway. So the correct choice is Narcan, which you can administer to a patient that's unconscious, and it's done intranasally. As always, remember to read the question slowly and carefully. Disregard the distractors like history of. Answer the question that's asked. Study hard and do well.